Hi everyone, Dr. Andrew Orr speaking. Today I want to talk about fertility and I want to talk a little bit about why people struggle with fertility and some of the things that people do wrong or things that basically people have missed. Whenever someone comes to see me for fertility, the one thing that I always tell the couple is that they must come as a couple because fertility issues affect both male and female, and we have to start getting that through to people because without a healthy sperm and a healthy egg, you don't make a baby. No matter how it happens, it just doesn't. Now, we get all sorts of couples. We get same-sex couples and we get heterosexual couples, and we have single people doing fertility work these days, needing assistance. And then we've got surrogates and we've got donors and all kinds of things these days. So the whole world of fertility is quite interesting, and but it allows couples, no matter who you are, it allows couples to have babies. But at the end of the day, it requires a healthy sperm and a healthy egg. So this is sort of what I want to talk about on this level. Now, even if you are in a same-sex couple, I still always encourage the partner to come along and be a part of that process because it's a support process. And if you can, as that partner, can do preconception planning along with your partner, you should be doing it too. And again, while you might not be an active part of that, if you are in a same-sex couple relationship, that you can still support your partner by helping your partner with diet and lifestyle and other things, because support is very, very important, not physically, but emotionally. Now, when we talk about same-sex couples and then we talk about heterosexual couples, especially the heterosexual couples, we need preconception planning, and same for same-sex couples. Or if you're doing single, if you're on your own and doing it as well, we need preconception care planning, and this is where a lot of people go wrong. I always talk about fertility being like a marathon. Now, if you're going to go out and try and run a marathon tomorrow without putting in the training, you're not going to get very far. You'll probably make it probably the small amount of the marathon, and you'll want to fall over and die. But look, the same goes for fertility. It's like a marathon. I tell people, you've got to put in that nutritional support. You've got to put in the training. You've got to get your body ready, because healthy sperm and healthy eggs go to make a healthy baby. And how do we get that? We have a healthy father, a healthy mother, a healthy male, healthy female. But let's, again, we look on the whole same-sex couple side of things, or a single woman as well. We want you healthy too, because you'll produce healthy sperm if you're a male in a male same-sex couple, or if females, they'll produce great eggs. So however we're going to make it, it's really interesting how we're going to talk about. But let's just talk about sperm and eggs. So no matter how you are doing this, no matter about your sexual orientation or who you're with, let's forget about that, because it doesn't really matter. How we all come about having babies, it doesn't matter. But what matters is healthy sperm, healthy eggs. Now, how do you get healthy sperm? You have to be a healthy male. And how do you get healthy eggs? You have to be a healthy female. Sure, we do have age-related incidents of, poor eggs and poor sperm quality is there for both males and females. We focus too much on the female side of things, that it's all about the females. I get females turn up here and go, I want you to help me with fertility. And I go, where's your partner? And, oh, he's down the pub, or, oh, no, he doesn't want, I'm sorry. But when I see couples, I see a couple. No matter what sort of couple that is, I see the couple. When we're talking heterosexual couples, I want to see the male and female. And part of my duty of care and part of the ethical and legal requirements is I need to see the male and female. And let's face it, 50% of fertility issues are related to males. And up to 85% of miscarriage issues can be related to chromosomal and DNA factors related to sperm. So if we don't look at the male, there's a lot of issues. So I see it often when, say, for instance, there's a female fertility issue like endometriosis. The whole focus will be on that female. Now, we know that women with endo may struggle more, but it doesn't mean you will have fertility issues. Same with PCOS and things like that. Some women with endo and PCOS have no struggles falling pregnant. But then what happens is the male gets left to the side, and a lot of males are unwilling participants as well, and they need a good kick up the behind sometimes. Because again, it's about support, and no man is born with the inherent right to conceive. And sperm change by 10% up to between 10 and 20% in a given month. So the ejaculation that you have today is different to what it'll be tomorrow, and the sperm quality will be different. Just because you did a semen analysis last week doesn't mean it's going to be the same this week. It changes. It's like bloods. Now I'll get to the other side thing. So preconception care is very important. It's a very important part of my fertility program, that we want you in a healthy weight range. As we see is a big issue with fertility. Weight. Stress is another issue that we address. And then nutrients and getting your body as healthy as it can be. And making sure you have the right food sources as well, because we're eating far too many refined carbohydrates, and embryos and sperm, especially embryos, don't do well in a highly glycemic and highly glucose environment. So we know that there's lots of studies around that now, and they've shown that when we change the diet, increase the protein, reduce refined carbs, that it can increase pregnancy rates by about 80%. So diet alone. It's not always the answer, because, you know, there's other things. And that brings me to the next thing. A lot of people that I see come through focus on blood tests and things like that, and they come through and go, we've had all the tests. And one thing I say to couples is, well, then it's my job to see whether you have done all those tests or not. And a lot of tests, look, a lot of blood tests aren't going to come back with anything, to be honest, but there are blood tests that are very, very important. And a lot of these, and a lot of testing and important investigations that should be done and part of initial fertility evaluation often aren't done. And that's what I see, and they're missed. And that's something I talk about as my fertility program too, to make sure. And that's why I use that no stone left unturned approach, where I'm looking at the very Western medicine, medical point of view, as someone who has had training in reproductive medicine, to actually look at things properly, because couples get things missed. And it depends who they see too, because not everyone that you see is qualified in the area of fertility, and that's another factor here in Australia as well. But that can be overseas as well. And a lot of people think they've had everything done, but I can guarantee that when people walk through my door, very rarely do I see couples have everything looked at. And sometimes the basics aren't even looked at. And then the tests and investigations that they should have, often they don't. And this is where I see couples failing too. And then, as I just said before, I see a lot of couples aren't on the same page. The male isn't participating, or sometimes it's the male that's the driving force and then the female isn't participating. There'll always be a bit of both. And then we get back to just being a couple, regardless of sexual orientation. A couple should be working together to support each other physically, emotionally, because let's face it, the emotional toll of going through things like IVF and fertility and struggling for years and years and years, it's quite high. So that's the other bit. The other bit I don't see is that people aren't getting up here right. And you can't do it on your own. I know people are trying to do everything they're on. They're Dr. Googling, they're trying to find this, they're trying to find that. You're not going to find all the answers on Dr. Google. And this is why there are professionals out there. And this is why a good counsellor is very important. We also talk about mindfulness and relaxation, because one of the biggest issues is stress and how that affects our body and implantation rates and so forth as well. And it does. No matter what anyone tells you, stress does affect you. It has an effect on testicular function, has an effect on ovarian function, it has an effect on our whole body. Stress can kill you. It can. And if people say to you stress there is not a part of fertility, they're telling you porcupines. Lies, basically. It does affect you. The other areas we see, you know, as I said, too much alcohol, drinking, smoking, all that kind of stuff, it does affect your sperm and it does affect your egg quality. There are some of the basic things that I see, and more of these things I go into when people come in to do my fertility program, and we talk about how things we can do to assist and help them increase their pregnancy rates and so forth. But more importantly, it's looking over their whole health history with a fine-tooth comb and going through every area of their life, medical investigations, their health, their family history, you know, is there any history of infertility in the family and so forth, their surgical history. And then there's some really, really important ones that, that a lot of people miss, really important ones that if you don't get those right and you don't test for them, you could be trying forever and ever. It doesn't matter how many vitamins, doesn't matter how much hormones you take, you will never fall pregnant unless you have these basic tests done. And I can't really sort of talk about those here because it then goes into like consults, but these are the sort of things that I talk about with couples when they come in to see me. Now, if people do want to come in and see me, they also have an option to go straight onto the fertility program. Or the other thing they can do, if they want to know a little bit more about it, they can come and do what we call a meet and greet program, meet and greet consult, where they actually come and meet and greet me, and we go over a little bit of their history, and then I go over a lot of what I go into and look at as part of my fertility program, which is it's a really good one to do, because then you get to introduce yourself to me, and I get to introduce to you, and you know, you get to see whether you want to do this or not. And I always say to couples, and it is true, and no matter where you go, if you stick, I say stick with that one person, or I think some people don't stick around long enough, but it is a matter of getting in and doing the work. And I know, regardless of anything else, when people come to see me, I say the ones that get in and they do the work, they take everything on board, the partners are working together, they do everything that I ask of them to do, they're the ones that get the baby. There's very few that don't. It's like anything in life, if you get in and do the things properly rather than trying to do it yourself, because let's face it, if you were doing everything right, you wouldn't be in the predicament that you're in. And it's because maybe some people have let you down and they haven't looked at things properly, and that happens a lot too. So it is about finding someone that knows what they're talking about, that can assist you, can hold your hand. That's what I tell people. I'm here to hold your hand, walk you through the process so that you don't have to do it all on your own, because everyone's trying to control everything. And when it comes to fertility, you can't control it. You are not in control. And that's a hard one too, letting go of control. Let's face it, when you're on IVF cycles, you are not in control. You are highly regulated. You are getting drugs to make you, and hormones and everything to make you do everything. So you're not in control. But what you can control is what you put in here, how you think, what you do with your body, and you and your partner, and then following through the advice that someone's given you, and hopefully it's the right advice. And that's what I do. So I work with a very, very tight network of people if I have to refer out, or if I need things and testings and all that done. And there's a reason I do that, is to make sure that everything's not lost. Because too many cooks spoil the broth, let's face it. That saying's there for a reason. So I only work with a very tight-knit, very professional group of people, and I'm very specific who I work with, because I know they have the same standards as I do. But when people see me, it is really that no stone left unturned approach with whatever I do, but especially fertility, because I do see a lot of couples going through years and years and years and years of it unnecessarily, and they probably could have 2, 3, 4 kids in that time if they had got the right advice and just simple things that were missed and investigations that should have been done. So if that's you and you've got to this time of year, because let's face it, a lot of couples get to the end of the year and then they just lose it, because it's another year that they've been through this often terrible process and heart-wrenching, and it, you know, you feel like a failure, and then, you know, everything else adds on, and you know, and you've got to have that partnership, because there's a high breakup rate in fertility when people are struggling for fertility, and if you don't have that tight unit, it all falls apart. So that's another part that It's the complete 360-degree thing we look at, not just one component where, oh, I just go and do IVF and then all my, the magic wand's going to happen. It doesn't work like that. Or I'm going to go and do some magic treatment, or I'm going to go and have acupuncture, or I'm going to go and take these magic herbs and I'm going to do that. It doesn't work like that. It's about everything coming together. It's a multi-modality approach, and that's how I approach things. Now, if you do want to know more, you can call my clinic, but I just wanted to run through some of those little things. You can always find me at www.drandreworr.com.au. Go to the website and find out. You can find me on Facebook as well, which you'll be seeing this on, and the Instagram page as well. But if you have got to this stage where you just need answers, this is something that you might want to consider. I do Skype calls, or we do online Zoom calls, we call them, but very much online calls as well. But a lot of time we will need to see people in person as well. But that's all explained to you by my staff. Yeah, so if you are struggling with fertility and you do need help, make sure you do reach out. Remember, a second opinion, or I say a 10th opinion, as much as it sucks having to explain your case to someone else, it's worth it. When we go and buy a car or we renovate a house, how many quotes do you get? Honestly, how many quotes? You probably get up to 10. But when it comes to fertility and it comes to our health, we often only get 1, maybe 2 quotes, and then we give up, or we think, well, what's the point? Well, the point is that not everyone you see is going to be able to help you. That's the reality. In every profession, there's good and bad. We have to admit that. Even in whoever you work for or whatever you do, there's good and bad in each profession. All right, I will end it there. But yes, this is a very serious topic, and yeah, the basics often do get missed, and that's what I'm here to make sure that doesn't happen. And just remember, never give up hope. There's always an answer out there, and I want people to know that. And I always say to people, if I can help just one more person, then I'll be happy. Okay, have a good day, and if you do need help, you know where to find me. Take care, everyone.